let's see how to use Motic analyzer. Once the data is filled and the slide is stained and digitally scanned, we get all the instructions or all this on the screen. So now I'm going to report the case of Kolte. She's a female who has a family history of cancer in her mother. First, we'll go to the pap smear reporting. So on this, I have a lot of options to put, whether it is a smear or not. According to the cells and according to the sample, we go on clicking the appropriate boxes as to how many cells are there. It's a smear reporting. There are no squamous metaplastic cells, so we will delete that. This is what is said as no negative for intraepithelial lesion or malignancy. Whether there are any organisms or how many inflammatory cells are there, depending on what we are seeing in the case, we report it. And here there are columns which tells us whether there is any reactive cellular change associated with inflammation, abnormal cells, and all this choice is given. We bring this image by importing it from the actual case and then select the appropriate image that we want to represent the sample, and then click OK, so that that image comes here. If we don't want it, we can always delete it. Okay, so after doing all this, there is a comment box in which we can comment regarding this case, and the technician's name is selected, whosoever technician has done this, so that we can follow up later on, and the doctor's name, and we click OK. That is done. This is finalizing of the pap smear report. Then we go to DNA ICM report. Okay, so this is showing us the DNA ICM report. Here there are all the columns which the analyzer has analyzed: the total number of cells, the neutrophils, inflammatory cells, abnormal cells, or the junks as dust particles or double nuclei. Here you can see the IOD, which is very important for the reporting. It has to be above 100. All this, when we check and we know that this is a normal, adequate and accurate sampling, then we look at these windows which are telling us what type of nuclei are being picked up by the DNA analyzer. The yellow color is for recycling cells, which is telling us that these nuclei are not aneuploid, but they are either recycling cells or neoplastic. So the larger cells we click and see whether the cell is showing any abnormal cell. When I have clicked on this large nucleus, I can see the cell here which is marked by a green arrow, and if I want to see that on an enlarged basis, I can see it here that this cell is showing a little enlarged nucleus. However, it is not aneuploid or very darkly stained. So this is all right. Accordingly, we go on clicking different cases, these nuclei. Here you can see there is a cluster which for a normal cytological analysis can look abnormal. However, the DNA is normal. It's a recycling cell. So the beauty of this is that you can see each and every nucleus, and this window is showing us the nucleus itself enlarged. Suppose we have gone to this, you can see that it's a very beautifully and encirculated single nucleus. There is no overlapping, but it is not showing hyperchromasia. So this also helps us. We want to see it enlarged, we can do that. And after doing all this, we see this this is normal cells which are green, yellow are all recycling cells. This is a dust particle which is red dot. We can even see that on the screen. On the final report, what happens is we see all the recycling cells which are picked up. The final report says there are no abnormal cells, so we write here that there are no abnormal cells detected. So routine screening is advised, and we select the technician's name, the doctor's name, depending on who has done that for the record purpose, and then finalize this. So once this is finalized, and the PAP is finalized, then only the report is generated. Once we click on this, the report we can see, recheck the name, age, and whosoever has sent this, check the pap smear report on this side, and check the DNA ICM report on this side, which is showing us no abnormal cells. and all the other cells like normal cells, recycling cells or cycling cells, and the nuclei are picked up and shown here by this. And this is a DNA image cytometry diagnosis which says no cells abnormal DNA ploidy detected, and PAP is reported as negative for intraepithelial lesion or malignancy. So routine screening is advised. So after all this is the final report, and this is how we report PAP final report, and this is diagnostic report of DNA aneuploidy, and the final report is generated and the analyzer